after the election. Doesn't that then become political football? The thing you said yesterday shouldn't be. It would then be an election issue. Why would you delay MAID until after the election?
Well, first of all, we're going to be introducing legislation. At this time, I can't talk about the timing for reasons of parliamentary privilege.
Certainly you can talk about the government's intention. I'm not asking you the details of the bill.
Sorry, I just came up the stairs.
Take a breath.
Yeah, exactly. So look, the important thing here is getting it right and the time that it takes to do so. When you look at the committee, and I really thank the parliamentary committee for their work, they heard from an extensive list of witnesses. We followed that process closely. For myself, in talking with the provinces and the territories, the time that's required, we got to get that right.
Yes, I heard you say all of that yesterday, sir. So what I'm asking is, how much time do you need? And if you're putting it off to after the next election, A, it's a political football, but B, aren't you opening the government to challenge?
I understand why you want today for me to say how long we're doing it.
I'd just like you to be transparent with Canadians about your intentions.
Of course, but what I'm saying is that due to parliamentary privilege, until the legislation is tabled, I can't talk about it.
You don't have to talk about the legislation.
No, but I can't talk about how long.
What's your policy intention? What's your policy intention?
The policy intention, as I've said, is to make sure that we take the time necessary to get this right. And I wish in a few days' time, once the legislation is tabled, we can have a very specific and detailed conversation around what time is necessary based on those conversations. But I cannot, if you really listen to the question that you're asking me, you're saying, why don't you put it in front of the election so it's not a political football? That is the essence of making it political. And that's exactly what I don't want to do. We can't base a system readiness on whether the timing of an election. We have to base the system readiness on how many people have been trained, about how ready the provinces are telling us they are, whether or not the curriculum that has been adopted has been well metabolized by the system. Those are the questions as a health minister I have to ask. Because at the end of the day...
It's been 3 years.
Yes.
I mean, how much more time? I mean, to what extent can we assume that those who are asking more time are just people who don't agree with it?
Well, look, I've talked with health ministers from New Democratic governments, health ministers from a Liberal government, health minister from Quebec, all of whom say their system isn't ready. So it's not just conservative health ministers that are saying this. These are every single health minister from every single province, every single territory, telling me they're not ready. So I mean, yes, it's 3 years. So in my conversations, nobody has told me they're ready. So let me just be clear.
You talked to 10 of them?
I've talked to all 13. And I can tell you that all 13 have expressed to me that their system isn't ready.
And they have
but I have
asked
said
you for an indefinite pause. So is that what?
That is not true. That is not true. There are some that are
yesterday asking for an indefinite pause.
There are some that are asking for an indefinite pause. And what I've said, and again, due to parliamentary privilege, in a couple of days' time, when we introduce the legislation, we can talk exact timing. What I'm saying right now, okay, is I can't talk about that exact timing until the legislation is tabled for reasons of parliamentary privilege.
Whether you're considering an indefinite pause, that's very different than 2 years, 3 years, more years. An indefinite pause.
I'm saying that until the legislation is tabled, I can't talk about timing. What I can talk about.
You can talk about.
What then, in your view, is enough people trained? The report yesterday that you said you agreed with said only 2% of Canadian psychiatrists have been trained. What level of training do you want to see nationally? If you were to give leadership, what's the level?
I mean, I think look, at the end of the day, this is delivered by the provinces, and so I rely on the provinces and territories to be able to tell us in their systems what their requirements are for state of readiness. Now, some of them are ideological on this issue, absolutely. Some of them are, their position is that they don't ever want this to occur, and I understand that, but that is not, in my view, a tenable position. I think that that there's very clear that mental suffering and physical suffering have equivalency. The question here is a state of readiness, and so what I think we're going to be looking for on that basis is the preponderance of reasonable opinion that the system is ready. And at this point in time, That isn't the case. And you know, when I don't have any province or territory coming forward and saying their system is ready, that certainly is an indication that it's not there, and that we need to be able to take the time to be able to make sure that this gets right.
7 provinces and all territories have asked specifically for an indefinite pause. So just can you be clear to Canadians, is that an option you're considering? An indefinite pause, no date on when the implementation comes.
So I've tried to answer this question, okay, and I'm trying to say that the challenge that I have when we introduce legislation, there's parliamentary privilege. I am not going to, okay, and hopefully I'm clear on this, violate parliamentary privilege. In a couple of days' time, when the legislation has been tabled, then I will come out and I will very specifically answer those questions when parliamentary privilege allows me. At this moment in time, I can only speak to general context. So
that's
I'll take the last
so
question.
you said only 2% of psychiatrists say they're ready. So what is the level you think should?
Well, I think that the question in this is a difficult thing, because we're never going to hit a point where 100% of people say that they're ready, and I appreciate that. For me, it is an iterative conversation, particularly looking at the Canadian Mental Health Association, CAMH, taking a look at a collection of provinces and listening to health ministers of different political stripes, looking for that preponderance of reasonable opinion to say that we're there.
So the levels could vary province to province, is what you're saying.
Well, I'm saying that, you know, we're going to have time to get these answers right. So
and you're required to give national leadership according to the committee.
Yeah, absolutely.
And you agreed with that.
Yeah, I agree.
So
what does national leadership look like?
Yes, in terms of take up on training. In terms of take up on training to green light the program.
Well, one of the things, because we have time, one of the things that I'm talking about with my counterparts, the provincial and territorial counterparts, is what those markers are going to be. It's clear that we're not ready at this point in time. So looking at, with provinces and territories, what is exactly going to be required to cross that threshold? That's not something that we have an answer for today, and it's something for that we have time.
What I'm hearing you say then, correct me if I'm wrong, I'm hearing you say that it's not going to be Ottawa that will decide what that threshold of training, proper training is. You will leave that to the provinces, given that they
We're going to do it collaboratively. I mean, I think it's, you know, one of the things that I had a very good conversation with the health ministers when we got together in Charlottetown to say that, look, there's a lot of areas where health is murky. We have intersectionality there where federal and provincial jurisdiction. So we need to work collaboratively. I cannot dictate to them, and they cannot dictate to me on this. We have to be able to be at the same table talking. One of the reasons that we need time right now, given the fact that the system isn't ready, that we're going to have to talk out exactly what readiness looks like. If it's not, it's clearly not there today, but what does readiness look like as we cast our eyes to the future, and so that we can be able to give more definitive answers to that.
And so how concerned, given what you laid out yesterday about the suffering of people with mental disorders, how concerned are you that Ottawa now is vulnerable to legal challenge of the entire scheme because you're basically denying some people who you say have a right to this, their right to access it?
I think that, you know, there's always a possibility, and I would leave it to Minister Virani to talk about, you know, the legal aspects. But what I can say is that I am certain that the courts would recognize that the dispute here is not whether or not there is equivalency between physical suffering and mental suffering. We acknowledge that equivalency. The question is whether or not the system is ready and time to make sure that the system can deal with that. And the reality is it's not. So I think that the courts will recognize that that time is needed in order to ready the system in order to deal with that imbalance in equity. Thank you so much.
Abides by the ICJ's provisions that they want you to follow. What pressure can Canada put on Israel in this context?
Well, I think I stand by what we've been saying as a government all along, which is that we believe in the ICJ as a process, as an institution. It's critical to the rule of law and how it functions internationally. And you've heard the Prime Minister and Minister Joly talk about the fact that when you're supporting that institution, you need to be abiding by the decisions that are being rendered.
Minister Virani, is scrapping the MAID expansion on the table? Like, are we, I know we're delaying it, but is scrapping it altogether a possibility?
So we received that report from the parliamentary committee. It's the second time they've actually looked at this issue, which is really, really important. We really value the input that both the senators and the members of parliament have provided. You heard us yesterday indicate that what we will be doing is we will be tabling legislation in the House of Commons. I'm not at liberty because of parliamentary privilege much to get into what is in the details of that bill, but we are addressing the need for an extension and putting a pause right now.
Là-dessus, qu'est-ce que vous répondez aux gens qui disent, au fond, on fait que pelleter le problème en avant, on va laisser les cours décider, et ça met tout le fardeau sur les victimes, en fait, celles qui sont aux prises avec des problèmes de santé mentale?
Ce que je peux vous dire, c'est que on prend les décisions comme un gouvernement responsable. On a écouté les témoignages qui étaient devant le comité avec les sénateurs et avec les députés. Ce qu'on a entendu, c'était tellement clair que le système n'est pas prêt en ce moment-là. Donc, on est tout à fait au courant avec les circonstances où les Canadiens se trouvent eux-mêmes vis-à-vis de leur maladie mentale, leur souffrance. On est là pour les appuyer, pour les soigner, et on va toujours essayer de faire la lutte pour eux. Merci beaucoup.
Reject the Senate amendments.
But it's his call, is it? It's not, you have no way to...
He can choose to bring that subject up in any conservative private member's bill slot. As I understand, he can trade up with the call.
So, so in terms of precedence, in terms of the Parliament's business, it's up to the Conservatives now to figure out where it lands in their private members' order of calling out.
Officially, Parliament has some Senate amendments to that bill, and Mr. Lobb wants those amendments rejected.
Sur 135, projet de loi sur les garderies, le gouvernement a décidé quand est-ce qu'elle allait le ramener. Il y a un amendement qui a été fait au Sénat. Est-ce que vous avez une idée quand il va revenir?
Comme vous savez, on a bon nombre de projets de loi à divers stades du processus législatif. C'en est un très important. Évidemment, on est très déterminé, mais pour ce qui est de la date où on va le ramener à suivre.
What is the government accept? What is the government's view?
The government's view of the Senate amendments? Yes. Our view of that bill is that we oppose that bill. We voted against that bill. We voted against that bill.
What day is the MAID legislation coming?
That again, we'll have more news soon.
Colin says in coming days and by the end of the week, so Thursday, Friday?
More news soon.
And how quickly can you get it passed, do you think? Have you already reached out to the other parties to try to expedite this through the parliamentary process?
Well, look, we know that's an issue that has been the subject of a lot of good work, actually, across party lines. One very rare example, all too rare example, of good work across party lines. We have a committee report that fundamentally there's a semblance of consensus there. So I'm very hopeful that we'll be able to have a smooth passage through Parliament.
Have you started talking to other parties about it?
I have not.
Yeah. Thank you.
Thanks.
Que pensez-vous du report de l'aide médicale à mourir en matière de santé mentale?
Bien, le ministre Holland a été clair hier. Les provinces incluses et un certain nombre de gens dans le milieu médical ont dit qu'on n'était pas prêt à aller de l'avant. Ceci étant dit, il y a d'autres travaux qui vont continuer. C'est un agenda plus large qui implique un travail étroit avec ceux et celles qui offrent des services d'aide médicale à mourir. On comprend qu'on a un travail plus long et plus important à faire.
Mais n'est-ce pas les pro-vie qui ont gagné, dans le fond? Parce que ce prétexte de la préparation, il y aura toujours des gens qui sont contre, qui vont le brandir. Ils diront, on n'est pas prêt, on n'est pas prêt.
Il y a effectivement toujours des gens qui vont s'opposer par principe à l'aide médicale à mourir, qui appellent ça un suicide assisté. Mais il y a toujours des gens qui vont vouloir qu'on aille de l'avant, mais dans les bonnes conditions. Et présentement, le ministre Hollande évalue que nous ne sommes pas encore dans les bonnes conditions.
Il y a des gens qui étaient insatisfaits de la position du gouvernement sur Israël-Palestine. C'est quoi l'état d'esprit de vos commettants à Québec, la communauté musulmane que vous avez vue à la mosquée de Québec concernant cette question d'Israël-Palestine?
Bien, c'est sûr qu'à Québec, on vit ça très différemment. Lorsque c'est le 29 janvier, on se souvient des familles et des amis qui ont perdu des êtres chers, des enfants qui ont perdu leur père, qui étaient en bonne partie hier à la mosquée. Donc c'est un endroit où on vit et on revit la douleur et les souffrances qu'on a connues le 29 janvier 2017. Évidemment, tout ça c'est chargé par le contexte international. Il y a d'autres douleurs et d'autres souffrances qui se sentent dans la communauté à Québec en lien avec la situation en Palestine. Et c'est ce qui s'est reflété hier, mais c'est normal parce qu'au Canada, peu importe où on est, on vit cette douleur lorsqu'on regarde ce qui se passe en Palestine et en Israël.
vous le sentez?
You got yelled at by in street protests today. You got yelled at by concerned about the level of anger the National Council of Canadian Muslims walked out on a meeting.
Well, I think the discussions around rebranding.
But there is indeed a level of anxiety and fear and concern everywhere across Canada. And yesterday, obviously, the focus was on the families and friends who lost a dear one in 2017. That was the reason why I was there, the reason why so many others were there, to show our closeness, our proximity, our solidarity with the families that are still grieving. It's a sense of grief that is never going to disappear.
Est-ce que vous avez perdu
with the provinces and territories and that we're respecting their jurisdiction? So it's certainly fed into the conversations that we're having, both about some of the changes we're making, but also about how can we work better with the provinces in the way that we've had.
Tout d'abord, j'étais pas là pour moi, j'étais là pour représenter mes concitoyens dans un environnement où on sentait beaucoup les relents de douleur et de souffrance que l'on vit depuis 2017. Et dans une société libre aussi, les gens doivent et peuvent s'exprimer. C'était par contre dans un contexte où l'attention était davantage portée vers les familles et les proches qui continuent à vivre difficilement la perte de leur père, de leur frère ou de leur mère. Donc c'est un peu complexe comme environnement. Je pense que ça s'est passé dans une manière correcte. Les gens se sont sentis en sécurité et on a pu continuer à être là pour les familles et les proches.
Mais quelle est votre réaction de
Ben, c'est pas vraiment une manifestation. Il y avait quelques personnes, dont une personne. C'est un jeune homme qui, comme beaucoup de jeunes hommes et d'autres personnes au Québec et au Canada, voit comme moi et comme vous ce qui se passe en Palestine et en Israël. Ça affecte beaucoup la santé mentale, ça crée des douleurs. Bon, à Québec, comme je le disais en français un peu plus tôt, le contexte est différent parce que le 29 janvier à Québec a un sens très, très différent. On se souvient surtout des douleurs qui continuent d'être vécues par les familles et les proches qui ont perdu leur être cher le 2017. Donc, merci beaucoup. Au revoir.
Oui, effectivement.
Statistique Canada a congédié un fonctionnaire pour des propos antisémites. Qu'est-ce que vous avez à dire par rapport à ça?
Ben écoutez, je vais devoir regarder pour vous revenir parce que je n'ai pas les détails, honnêtement. Ce matin, j'étais sur les questions d'épicerie, mais ça va me faire plaisir de regarder ce qui s'est passé.
Est-ce que vous avez été consulté? Est-ce que votre bureau a été consulté?
Pas à ma connaissance. Pas à ma connaissance, mais ça va me faire plaisir de regarder l'enjeu puis de vous revenir.
Qu'est-ce que vous pensez du report de l'aide médicale à mourir?
Je pense que c'était la bonne décision parce que derrière cette décision-là, puis je pense que mon collègue, le ministre de la Santé, s'est exprimé là-dessus, il y a une question de s'assurer que les provinces soient préparées au changement. Et je pense que ce qu'on a entendu des provinces, entre autres du gouvernement du Québec, c'est que c'était souhaitable dans les circonstances. Alors, je pense que ça va dans cet esprit-là de respecter aussi les besoins des provinces, de s'adapter lorsqu'on fait un changement aussi fondamental.
Sur l'épicerie, M. Champagne, vous aviez parlé de peut-être des marques étrangères, des bannières étrangères. Est-ce que vous parlez?
Oui, même ce matin.
Mais lesquelles?
Ben non, je ne peux pas tout vous dire, sinon vous ne me poserez plus de questions la semaine prochaine. Mais on regarde avec des acteurs étrangers, justement. J'étais en conversation avec une de ces bannières-là ce matin. Écoutez, c'est pas facile. Si c'était facile, ça aurait déjà été fait. Par contre, je pense que ce que les gens s'attendent de nous, c'est d'essayer. Moi, ce que les gens me disent, M. Champagne, tant mieux. Moi, il y a quelqu'un qui essaie. L'idée, c'est de brasser. Non, je pense pas que c'est dans... Non. Je pense pas qu'on est dans des questions d'aide. C'est plutôt de dire, écoutez, la donne a changé lorsqu'on a changé la loi sur la concurrence. Je vous dirais que ce que j'ai entendu des gens avec qui moi j'ai parlé, les gens me disaient, écoutez, le marché canadien était reconnu mondialement comme un marché fermé. Et là, avec les changements qu'on a faits à la loi sur la concurrence, ça ouvre de nouvelles opportunités. Maintenant, ceci dit, est-ce que c'est facile? Non. Est-ce qu'on doit essayer? Oui. Est-ce que les discussions avancent? Oui. Mais vous savez, c'est rien qui peut se faire d'une journée à l'autre. Par contre, je pense, moi, fondamentalement, qu'à la fin, je l'ai dit, ce qui va faire la différence au Canada, c'est d'avoir plus de concurrence parce que à ce moment-là, vous avez plus d'options et on le voit dans d'autres pays. On l'a vu en Australie, on a regardé ce qui s'est fait en Nouvelle-Zélande. Ça a une tendance à avoir une pression sur les prix pour aider les consommateurs. Alors, c'est dans cet esprit-là que je le fais. Est-ce que je vais y réussir? Je ne le sais pas, mais certainement, ça vaut la peine d'essayer parce que la question de l'épicerie, c'est une question qui revient constamment quand on rencontre les gens. C'est pas facile de se lancer.
Est-ce qu'un ministre peut influencer sur...
écoutez, quand j'ai commencé avec Nordvolt, les gens disaient que j'étais rêveur, puis ça a commencé avec un appel. Quand on a fait Volkswagen, c'était aussi un appel. Les gens m'avaient dit, écoutez, vous réussirez jamais. Il n'y a jamais eu une compagnie européenne qui est venue s'installer au Canada dans le domaine de l'automobile. Ça a fonctionné. Alors, écoutez, le pire que ça aurait coûté, ça aurait été un longue distance, comme on disait chez nous, un appel interurbain. Puis le mieux, ça sera que ça va nous amener. Mais comme je vous dis, du premier appel que j'ai fait aujourd'hui, il y a déjà des pourparlers. Est-ce que ça va aboutir? Je ne le sais pas. Mais certainement, ce qui a changé la donne, c'est, je pense, cet esprit-là d'amener plus de concurrence dans le marché. Et bon, écoutez, on va voir la suite des choses. J'ai parlé à plusieurs personnes.
Have you spoken to Rogers or Bell about their price? Mocking you this morning, saying that you threatened them, and now you're saying you're disappointed with not lowering prices. Can you react about this?
Listen, I don't spend much time about this guy, honestly. But what I care about is Canadians. No one knows him in Quebec anyway. You know, he barely mentioned his name in Quebec, and if you find people who know him, you please give me their name. But what I would say is that I don't really care what he does or what he thinks. What I care is what Canadians think and what Canadians feel. One thing that I know is that Canadians are saying, listen, someone needs to try to shake up the tree. That's what I'm doing. And the fact, I would say, when he's missing the point, not the first time, I would say, but, you know, we demanded more transparency from the grocery chains. Like I said, I want more transparency. And now, in order to address that, we reform competition law. And following that, what I'm saying is that now I'm saying that the commissioner, we would expect that they would use his new powers. So, I mean, it's very consequential. You know, we asked something, we looked at the outcome, we changed the law, and now we expect the commissioner to use his new powers. So I think it's very consequential to what we're doing, and I think Canadians understand that. And honestly, the fact that the competition commissioner has new powers should be something that's going to change the market, because fundamentally what we need is more competition, and that's why I am talking to international grocers to make sure that, you know, potentially one may want to come in Canada. But I do know one thing, having talked to the CEOs, is that one of the things that was, you know, making them not looking so much at the Canadian market was these barriers that we had that are now being removed through the competition.
Monsieur Champagne, on parle d'exemples, si on veut des exemples.
Mais l'exemple le plus clair, c'est que vous savez, avant qu'on adopte le projet de loi, il y avait des restrictions dans les baux. C'est-à-dire, quand vous aviez une grande bannière dans un centre commercial, il y avait habituellement des restrictions sur la concurrence qui faisaient que si une nouvelle bannière voulait venir s'établir, ou si vous aviez un épicier indépendant, il ne pouvait pas s'établir dans le carrefour commercial. Vous savez, quand vous allez dans les régions du pays, souvent il y a un centre commercial, et si vous regardez souvent, vous avez seulement une grande bannière. Alors, moi, je peux vous dire, il y a un CEO, entre autres, qui me dit, Monsieur Champagne, on avait regardé le marché canadien, mais on n'était pas capable de trouver des endroits pour louer. Alors ça, c'est fondamental. Quand je leur ai dit, écoutez, on change la loi, il m'a dit, maintenant, si vous changez la loi, je vous dis pas que c'est facile, je vous dis pas qu'on va réussir, mais je vous dis que ce qu'il me disait, c'est que ça avait été un des freins majeurs. Et là, maintenant, ce que je dis aux différents PDG à qui je parle, c'est, écoutez, on a amendé la loi. Donc, pour répondre à la question de votre collègue, quand les gens me disent, ou leader d'opposition, je dis, écoutez, on a demandé des choses, on veut plus, on amende la loi. Aujourd'hui, on interpelle le Bureau de la concurrence. Pour moi, c'est très conséquent. C'est ce que les gens s'attendent.
Mais vous ne trouvez pas que vous contrevenez à l'indépendance du commissaire?
Je respecte son mandat indépendant parce que la loi prévoit même qu'il y a une consultation entre le ministre et le commissaire s'il y avait une étude de marché. Ça fait partie de la loi. Donc, je respecte son indépendance. Par contre, je souligne qu'il y a des nouveaux pouvoirs. Puis je dis, écoutez, je pense que les gens à la maison diraient, vous avez des nouveaux pouvoirs. On espère que vous allez les utiliser à bon escient. Parce qu'on a besoin de plus de concurrence.
Monsieur Champagne, l'application RAFCAN, il y a un rapport qui dit que 76 des entreprises contractées par le fédéral n'ont fait aucun travail. Qu'est-ce que les Canadiens doivent penser?
C'est problématique, évidemment. Alors, je sais qu'il y a des gens qui sont en train de revoir cette situation-là, d'enquêter, mais c'est clair, il faut s'attendre aux plus hauts standards de tous les gens avec qui on contracte, évidemment,
au nom du gouvernement.
Écoutez, j'ai pas les détails, mais de la façon dont ce que vous me rapportez, puis effectivement, on s'attend au plus haut niveau de standard quand on pense qu'il y a des contracteurs qui agissent au nom du gouvernement du Canada pour les Canadiens. Merci, je vais aller parce que si je veux garder ma place, il faut que je sois là de temps en temps.
Supplies to provide for the innocent civilians in Gaza. This brings our total allocation of humanitarian aid to Gaza to $100 million. This additional $40 million is going to go to the World Food Program, UNICEF, World Health Organization, and the International Committee of the Red Cross and the Red Crescent, and other trusted partners that we've been working with since this conflict started, and even prior to that. This is a commitment that we made that each and every innocent civilian who has humanitarian needs, we will step up for them, and we're stepping up in a big way with an additional $40 million today. Throughout this conflict, we've centered our decisions on the lives of innocent civilians in this conflict, and this is a demonstration of Canada's commitment to continue to deliver much-needed aid.
Can you precise something? Did Canada hold on or retain a check to UNRWA?
This is a pause. Is a pause. We paused any additional funding going.
What does it mean, additional?
Any additional funding that would have come to...
Anything that was already announced went on as planned?
Of course, because when we found out about the serious allegations from UNRWA itself and the UN body, we did the responsible thing, which is to pause pending an investigation. A pause is a pause. A pause on additional funding. And we made that very clear, and I made that very clear in my statement when I made that announcement. We will wait the results of the investigation. I can tell you that we've done a lot of work with UNRWA over the years.
The money that was supposed to go, it went as planned.
A pause is a pause. We announced a pause. We announced a pause on additional funding to UNRWA based on the serious allegations, and we await the results of the investigation. But today is about providing additional $40 million. And just to be clear, we not only worked with UNRWA, we also work with a number of organizations on the ground. And this $40 million will ensure that humanitarian aid will continue to flow to the most innocent civilians on the ground.
Would that $40 million have gone to UNRWA? Are you transferring money that otherwise would have gone to UNRWA to these other organizations?
We have instituted a pause pending the results of an investigation, and the pause was based on preventing any additional funding to go to UNRWA. I've been very clear on that.
Can you precise when would have been the next payment to UNRWA? When would
there is two types of support that we've been providing to UNRWA. One is long-term support, and one is money for Gaza. The money for Gaza has been dispersed to UNRWA, and they've used it for to deliver much-needed humanitarian aid and education and other duties that UNRWA has on the ground, and they've done good work over the years. But the long-term support is carried out over a number of years, and that, of course, will be impacted by this pause. Okay? Thank you so much.
Minister Sutz, can you come to the whole camera? Minister Sutz, can you come to the whole camera?
We're operating in short bands. Are you concerned that this is a sign that the child care program is falling apart?
So thank you for the question. Obviously, we're following closely what's happening in Alberta. All provinces and territories have signed on to these historic agreements to ensure that we can collectively move forward with building this national child care system. We fully expect that all provinces and territories will execute on their agreements, they'll follow through on the commitments, and I'm sure Alberta will be no exception to that.
Does that mean that you expect provinces to put more money towards it? Because the daycare operators are saying they just don't have enough to stay open and they're going to go bankrupt.
When we signed on, we made a historic $30 billion commitment to build this national system. Every province and territory has benefited from that funding. They had certainty of what that looked like. It increases every July in their annual payment. So we expect, of course, that the provinces are also contributing, as they have been, and as we expect to continue to see, to ensure they execute on their commitments.
You make a decision
Sorry, go ahead. More to come very soon. Obviously, we're doing our due diligence to make sure. More to come soon. Thank you. Thank you.
MCFA is trying to have your position, to know a position. Can you tell me?
As I just said, more to come very soon. We're just doing our due diligence, making sure we've covered all our bases, understand the implications of the proposed amendment, and I'll be back to you soon. Thank you.
Avec l'annonce de M. Miller la semaine dernière, l'annonce pour les étudiants étrangers.
Oui.
Ils ont annoncé un plafonnage de 2 ans et maintenant vous avez annoncé pour les logements pour étudiants. Comment ça vient ensemble, les deux?
Oui, c'est important de comprendre la raison pour chaque mesure. Dans le cas des mesures qui ma collègue, M. Miller, a introduit juste récemment, ce n'est pas juste une mesure pour améliorer la situation du logement, c'est important aussi de restaurer l'intégrité de le programme pour les étudiants internationaux. Mais aussi, il y a des conséquences positives pour les marchés du logement dans la communauté avec des institutions, absolument. Mais pour moi, c'est très important d'adresser les financements pour construire des logements pour des étudiants aussi. Quand nous faisons des investissements de construire des logements pour des étudiants, des mesures assistées aussi des personnes qui habitent des communautés avec des universités, des collèges, parce que ces mesures réduisent la pression sur le marché pour le loyer de logement. C'est très important. Quand nous utilisons des mesures pour réduire le coût pour construire des logements pour des résidences, pour des étudiants, il y a beaucoup de résidences pour des étudiants. C'est simple, c'est une bonne idée et j'ai hâte d'observer des progrès après ces mesures.
Est-ce que ça pourrait réduire le délai du plafonnage de 2 ans?
Réduire quoi de 2 ans?
Le délai de 2 ans, parce que le plafonnage c'est pour 2 ans. Est-ce que ça viendrait réduire ce délai-là? Est-ce que ça pourrait réduire?
Le délai pour construction? Plafonnage, qu'est-ce que c'est plafonnage?
The cap for the students.
Oui.
International students.
Oui, c'est pour 2 ans, pour maintenant. Et après 2 ans, c'est possible de reconsidérer. Mais en même temps, nous cherchons des opportunités pour établir un programme.
10% près des sous-contractants pour ArriveCan n'ont pas fait de travail. C'est du gaspillage. Il y a eu des graves.
Ça, c'est un enjeu ce n'est pas le concern de le président du Conseil de Trésor parce que c'est une matière en progrès avec quelqu'un d'autre. Donc, je n'ai pas de commentaires maintenant.
Statistique Canada a congédié M. Awada. Est-ce que ça a été fait dans un due process?
Say that again?
Could you tell me your thoughts on the government potentially looking for a rebrand on the climate action incentive payment?
I think the important part is that the environment is a key part of our platform going into the next election. And we have a plan for the environment. The Conservatives have none. And that's what you need to understand. That's what is important, and that's what we're going to run on. Thank you.
Well, we're following up what's going on. That's all for now.
Il y a M. Miller qui a ouvert la porte à un remboursement pour le Québec pour les demandeurs d'asile. Qu'est-ce qu'il y a dans les cartons, là? Apparemment, on attend une annonce imminente.
Oui, bien, il y a plusieurs discussions. Je sais qu'il y a des discussions entre le ministre Girard de Québec et Mme Freeland là-dessus, de la même manière que M. Miller parle avec Mme Fréchette. J'ai moi-même parlé avec Mme Fréchette vendredi dernier. Et on reconnaît les efforts supplémentaires de Québec, des efforts énormes à tout point de vue, et l'impact que cela a aussi sur les services à livrer par le gouvernement. Donc, il va éventuellement avoir une annonce où on va transférer plus d'argent au Québec.
Est-ce que ce sera ce que M. Legault demande, 470 millions?
Bien, ça va être... Ça sera annoncé sous peu par le gouvernement, mais ça va démontrer clairement que nous sommes là pour à la fois reconnaître les efforts de Québec et appuyer ces efforts.
M. Legault sera content?
J'espère.
Pensez-vous?
C'est lui qui vous le dira.
Votre opinion sur Denis Coderre?
I wanted to ask you, the Royal Society of Canada had a report that came out today that says we're failing our seniors post-COVID in long-term care homes. Specifically, staffing is an issue. What is your message on that report?
Well, I'm very excited for the work we're doing with provinces on the Aging with Dignity plans. We have agreements with every province and territory. We're going to be launching the first one soon, outlining how the money that we're putting forward in the area of helping seniors and dealing with long-term care works. We're also working on the Safe Long-Term Care Act, which is something that we'll be introducing in the near term. But there's deep challenges. I think that COVID exposed the weaknesses in our long-term care system and the underinvestment that occurred. This is largely an area of provincial jurisdiction, but we put up our hand and said we all have to work together. And so these agreements, these bilateral agreements are going to be critical, and so will that legislation.
Do you think that long-term care homes now are in a fundamentally different position than they were during COVID? Do you think that advancements have been made?
Yes, I think that that significant improvements have been made. I think that the public attention that's been on this, the work that's been undertaken by provinces and territories have ameliorated the circumstance, but we still have a long way to go. And that's what these Aging with Dignity agreements are about. That's what our Safe Long-Term Care Act is going to be about. And certainly, whether or not it's in the face-to-face or telephone conversation meetings that I'm having with my provincial and territorial counterparts, this is a point of regular discussion.
On assisted dying, do you anticipate the government bringing in any changes on this before the next election?
Well, I think that we're going to be introducing legislation in the next short while, talking about the specific issue of where medical assistance in dying, where mental health is a sole underlying condition. But outside of that, at this point in time, no, I'm not anticipating any additional changes to the MAID regime right now. I think there are conversations that we're having with provinces and territories around some of the concerns they have, but at this point, I think we need to focus on the readiness of the system with respect to where mental health or mental illness rather is the sole underlying condition, and that we're not contemplating any other changes to the MAID regime at this point.
On the sole mental illness.
Sure. Yeah.
Do you anticipate making those changes, introducing those changes, bringing in those changes before the next election?
Well, again, because of parliamentary privilege, I can't speak to timing. Once we table the legislation in a couple of days, I'll be able to more clearly answer that question.
Quand on parle des gens dans le système de santé, il y a des gens qui nous disent oui, on est prêt à faire face à ces demandes-là, on a les mécanismes en place, on a les ressources en place. Puis là, vous dites que vous, on n'a pas les ressources. Qu'est-ce qui vous fait dire, vous, qu'on n'a pas les ressources, s'il y a des médecins qui disent qu'on les a?
Oui, c'est la question
d'aide médicale à mourir et de maladies mentales comme seule condition.
Oui, non, c'est dans cette situation-là, il y a certains médecins qui sont prêts et il y a certains aspects du système qui sont prêts, mais c'est pas le cas partout dans le système.
Donc, quand vous dites on n'est pas prêt, qu'est-ce qui est pas prêt?
C'est le nombre de personnes qui a reçu l'entraînement pour les curriculums. Alors, c'est clair dans le système qu'il y a une attente que les personnes comprennent bien la situation où les personnes peuvent accéder à l'aide médicale à mourir. Et quand ce n'est pas possible, et si l'entraînement n'était pas là, le système n'était pas prêt, même s'il y a quelques médecins qui sont prêts, ce n'est pas le cas pour tout le système généralement.
Donc on en a besoin de combien? Qu'est-ce qui manque pour qu'on soit prêt?
Oui, c'est plus de l'entraînement, plus de...
Mais de combien, c'est ça? Si
oui,
c'est...
Non, je comprends bien les raisons pour lesquelles vous besoin les chiffres, mais c'est une conversation avec les provinces et les territoires de trouver exactement le pourcentage qui va marcher bien. Maintenant, le pourcentage est 2%, ou presque ça. Ça, c'est pas acceptable, c'est pas suffisant pour continuer, mais les exacts chiffres, ça, c'est la raison pour laquelle on a besoin le temps de parler avec mon homologue dans les provinces et territoires, de trouver exactement l'état que le système est prêt.
Hey, Minister, when's your meeting with your NDP counterpart, and what are you hoping comes from that meeting?
My meeting with Don Davies is almost every day. We had a good conversation yesterday. I suspect we'll have another good conversation today. There's a lot of complexity to the conversations that we're having, of course, and that isn't just with relation to pharmacare. There's a lot of different aspects that we're talking about, elements including the Safe Long-Term Care Act that are in the agreement, talking about the status of other work that is important to Parliament. So it's daily. What are the contents of those conversations? Retrospectively, once we're ready to announce something, I'm more than happy to go into all of the machinations and what was the back and forth. The reason we don't do that now is just because sometimes it looks like this might be working, and then we have a conversation and find out that it's not. And so there's a lot of movement back and forth. I think it'd be very confusing to put that on display publicly. And in fairness, they're negotiating. And in negotiating, I don't know their final state, and they don't know mine. We're really trying to push and pull, and that process is ongoing.
You said dental care is helping to inform pharmacare. What did you mean by that?
Well, I think, there was a really great collaboration on dental care. This was a tough conversation. This is the largest federal program, is potentially going to touch 9 million Canadians. It's a very complicated program. There's a lot of different elements and facets to it. It required a lot, two parties that aren't used to trusting each other and working together and coming to the table. Two parties that have major differences, but setting aside those differences in the interest of serving the public to try to find a path forward. And that's what we're trying to do with pharmacare. We have very different views on things. They are a completely different political party. I am in the Liberal Party for very strong reasons. Don Davies is in the Democratic Party for very strong reasons, and those reasons remain and those differences remain. So setting aside those differences and finding areas of commonality, ways that we can work together, it's tough, but we did it in dental. And you see now we are having more and more folks registering. Soon we're going to be dealing with 71 and up. By the end of the year, everybody will have had an opportunity to register, and the end result of that hard work, of that compromise, is that every Canadian will have access to dental care. So it's worth the effort, but it isn't easy.
We haven't heard you say the words public, universal, single-payer pharmacare. Do you still believe in that, or do you not? Is that
what I believe is that every Canadian should have access to the medicine they need to be healthy. And I think that we have a couple of different models. We have what's being done in PEI that's been highly successful. We've run that as a pilot. That's one model. The NDP have been strongly advocates of another model. And so part of the conversation is, okay, well, how do we get out of the theoretical and into the practical? And there are cost considerations to that. So part of the reason I haven't been specific is because these are all part of the conversation around, how best we can understand to meet the needs of the country in the space of pharmacare. So, I deliberately, am holding back some of that because that's part of our conversation and that's part of the deliberation that I was talking about earlier.
Minister, what do you make of the reports that more Canadians were accessing MAID than in other countries where it was legalized? What does that mean to you?
Well, yesterday I used the example of my own uncle, who several months ago got diagnosed with terminal cancer and had a choice to make. As the disease progressed and his death was certain, he had to say, did he want to access MAID and choose his death on his terms, or did he want to deal with the worst ravages of the illness? He made the decision to access MAID. Over 96% of people who are accessing MAID are using it in that way. It's an end-of-life circumstance where they're choosing the time at which they want to end their life. So, death is a deeply uncomfortable conversation. I wouldn't wish what was visited upon my uncle to happen to anyone. But, if fate turns that way, and if that's the fate we meet, then it's important that we be able to access choices about our own end of life. And that's over 96% of these cases. So I understand, people see, oh, there's a growth or there's a big number. But what's behind that number? What's behind that number is people who are suffering, people who are facing the end of their life and doing it on their terms and their way. And my uncle was at great peace when he made that choice. And I think that's for the over 96% of cases where we're talking about MAID. I think that folks are in a similar circumstance.
Thanks, Minister. And I might also ask you about public health records. Public Policy Forum says Canada's handling of health records is woefully out of date and negatively affecting patient care.
Totally agree. Yeah, I mean, absolutely. I think I was in Charlottetown You know, one of the first, it was very early in my mandate as health minister, saying that data saves lives, that transforming the way that we deal with health information and how we share information inside of our health system is critically important. So, you know, coming to an agreement on a digital health charter, understanding that we have to break down these walls and share information and be less proprietary. Of course, protect security, protect data sovereignty, but find a way for the systems to be able to share that data and to move it into modernized systems is absolutely critical. So a big part of the bilateral agreements that we're doing, that we've already been announcing, is moving to digital patient records, is having patients being able to access their own records, is putting dollars into data and systems. You know, it is sometimes not sexy to talk about, but this is the kind of stuff that can really transform healthcare, and we've been talking about it far too long. We're moving to action, and that's certainly something that we continue to be focused on.
Do you think we can do it by 2028, which is what people are calling for?
Yeah, I mean, I think in terms of timeline, we have to do it as fast as possible. I think, you know, we're making huge progress. These investments are yielding really important results. I'm extremely encouraged talking to my provincial and territorial counterparts. They get it, that they have to sort of be less proprietary and make more movement to share data, but we have to keep, you know, pushing the pedal to the metal here. And, you know, that's one of my jobs. I see myself as a convener in the health space to try to bring folks together, try to find common ground. It's not within our control. We have to work together. There's all kinds of disparate jurisdictional elements to this, but I think that's what Canadians expect. Canadians expect us all to be pulling in the same direction and setting aside our differences and our jurisdiction and our egos and just get it done.
Thank you,
Thanks so much.
Thank
you. Thanks.
Our findings is that 6% subcontractors weren't actually doing work on the asset.
Well, you saw the Ombudsman report yesterday. Most of the recommendations that the office is suggesting have already been implemented, and the others will be followed upon.
And part of the Treasury Board's thing was to sort of cut down on extraordinary costs. Are you planning to sort of have more work in the public service versus subcontractors moving forward?
Yes, this is also being done. Lots of initially allocated some contracting work is now internally being done. Obviously, COVID-19 being almost ended is making that a lot easier and faster.
Do you have a message for those subcontractors who didn't do the work?
Well, they'll continue to be important, but in a different manner.
Monsieur Duclos, quand on parle d'immigration, des demandes de Québec concernant les demandeurs d'asile, est-ce qu'on a le 470 millions de dollars que Québec demande pour leur donner?
Bien, mon collègue, M. Miller, et ma collègue, Mme Freeland, travaillent activement là-dessus. On sait qu'il y a des montants déjà disponibles pour le gouvernement du Québec en matière de francisation, de soins de santé qui sont initialement couverts. On sait que c'est une responsabilité à la fois opérationnellement partagée, mais aussi financièrement partagée.
Ils demandent un gros montant, 470 millions. Est-ce que vous l'avez à leur donner complètement?
Ça, c'est la bonne question à poser à mon cher collègue, M. Miller. J'entends dire qu'il y a des montants déjà alloués de ce 470 millions en matière de logement. Ce qu'on sait aussi, c'est qu'en plus de ce 470 millions, il y a plusieurs centaines de millions de dollars qui sont envoyés au gouvernement du Québec pour l'intégration, l'apprentissage du français et les autres services connexes.
That they can't get out. Do you have a message for those who have applied and their family members can't get out?
Well, right now, like you said, we've had a substantial amount of applications. It is butting up against that cap, which I said has been flexible. I think the challenge now is actually getting those people who have gotten to the advanced stage and have their applications accepted out into Cairo to make sure that we can go to the next stage of actually doing the biometrics and then onward to Canada. And so, again, my biggest fear in implementing this program was entertaining false hope. We are, to my knowledge, the only country in the world doing this in such an extended way and offering the services, the advocacy to get people out. But right now we haven't been able to, and it's immensely frustrating, but it won't diminish our resolve.
Is pausing the UNRWA funding going to impact, and if you don't mind, just pausing the UNRWA funding going to have any impact on how difficult it is to get some of these families to Canada?
Very hard to game that out. There are a number of layers of authorities on the ground, including a terrorist organization that has their say, and it's not beyond them to play games.
Le gouvernement du Québec a 4 demandes précises concernant les demandeurs d'asile, notamment 470 millions de dollars supplémentaires. Est-ce qu'on a cet argent-là, d'abord?
Ouais, de un, c'est quelque chose que je travaille dessus avec la ministre Fréchette. C'est clair que Québec a fait plus que sa part depuis belle lurette.
Assez pour avoir 470 millions
Ben,
de dollars?
c'est une discussion à suivre. Écoutez, il y a certains éléments qui ont été ventilés dans la demande qui relèvent de mon autorité et j'ai la capacité d'agir, mais je pense que d'égal à égal, on peut avoir une conversation mature, pas sur la place publique, mais sur les sommes qui sont requises. Évidemment, c'est une relation qui va dans les deux sens et on a aussi, des demandes qui sont pertinentes vers Québec.
Une autre demande du gouvernement du Québec, c'est de mieux répartir ceux qui arrivent, notamment dans les grands aéroports, Montréal, Toronto, mais évidemment Montréal pour Québec. Qu'est-ce que vous pouvez faire pour les aider
C'est clair que le flux affecte Pearson et l'aéroport Trudeau. C'est clair qu'on peut mieux coordonner. On a déjà envoyé beaucoup de gens dans des hôtels en dehors du Québec. Alors, c'est quelque chose qu'on continue de faire. Mais évidemment, ce sont des flux historiques qui sont sans précédent et évidemment, on va faire un effort supplémentaire avec les deux paliers. Encore une fois, il y a deux provinces qui sont surtout affectées, évidemment, le Québec et l'Ontario. Ce que l'on ne mesure pas nécessairement, c'est le flux des gens à l'intérieur du Canada et des gens, évidemment, qui viennent au Québec, qui se dirigent ensuite vers Toronto.
Est-ce qu'il y a moyen de réécrire des programmes pour donner un avantage à ceux qui quittent les grandes villes, notamment?
Il y a plusieurs moyens coordonnés. C'est clair qu'il y a certaines provinces qui en veulent plus. Il y en a d'autres, comme le Québec, qui demandent qu'on fasse un effort supplémentaire pour répartir ces gens à travers le pays. On ne peut pas traiter du monde comme du bétail. En même temps, je pense qu'il n'y a personne qui dirait qu'on devrait. Mais c'est un effort, c'est à suivre aussi. Puis le but dans tout ça, évidemment, une des autres demandes, c'est de réduire le flux qui vient au Canada. Puis c'est un travail de fond qu'on fait présentement.
Israel remain kind of the main stumbling block in terms of getting Canadians out? Is there anything more you can do about it?
I wouldn't say we have to work with the partners on the ground, including Israel. They have there are applications in for certain members to come out. It isn't a whole wave of 1,000 people, and that still is something that we're working on. So no answer yet, but it's not something that we'll stop working on.
When was the last time you got anybody out? I haven't been,
I can't recall. I'd have to check that. We've gotten some people out on an ad hoc basis, piecemeal, but not in waves. And in fact, there are still Canadians remaining in Gaza that we've not been able to get out.
Not really your department began, but there's a Canadian citizen journalist, Mansour, I can't remember his last name, who was apparently picked up by the IDF. Do you have any information on that?
No confirmation that he has been picked up by the IDF, but as a Canadian citizen, we would advocate for his release.
And have you been in touch with the Israeli government to confirm these reports? I mean, it's pretty serious if we're hearing that the IDF has picked up a Canadian.
That's a question you have to ask Minister Joly and consular officials, but we are in contact with officials, particularly to get a number of Gazans out.
La Grande-Bretagne dit qu'il faudrait commencer à songer à avoir un État palestinien. Est-ce que c'est des conversations qu'on peut avoir ici au Canada? On est en faveur ou contre?
On a toujours été pour une solution à deux États. Maintenant, il y a deux parties au conflit qui sont pour une solution à un État. Ils sont en désaccord sur la nature de l'État lui-même. Alors, c'est à suivre, mais évidemment, le Canada a toujours eu cette position, puis on va continuer de l'avoir.
Vous appuyez la demande de la direction?
Une solution à deux États, absolument. Merci.
Question, is the government going to support the carbon pricing bill? What's your plan on that one?
The carbon pricing bill?
The farm for farms.
No, we do not support that.
You don't support the bill as amended, or you don't support it at all?
We don't support the bill.
Period. Are you going to support the bill as amended?
We don't support the bill.
In any form?
Correct. Well, the bill has not been amended yet, of course.
The Senate amended it.
There are proposed amendments that the Conservatives are now trying to remove from the bill.
Are you going to support those amendments?
We do not support the bill.
That's not answering my question.
We don't support the premise of the bill. How about that?
Still not answering my question. Are you going to vote against the bill in all of its formats?
We will await the debate that's going on in the House of Commons. It's a very unique and perhaps tortuous process to undo Senate amendments on a private member's bill. We'll see how that goes. That's why what I would say to you right now is that we do not support this bill, period. Yep. Anything else? Merci.
On the carbon, are you planning to do a rebrand of the carbon pricing?
Well, there's certainly lots of talk about it. We've certainly been reflecting on that. I don't want to get out in front of my friend and colleague, Minister Guilbeault, but I think we've been certainly thinking about how can we communicate better.
What would you like Canadians to know about the carbon pricing that you think they're not getting now?
Well, I think we want to make sure that Canadians understand, and I think we do have work to do in this regard, that 80% of Canadian households get more money back than they actually pay in the carbon price. I mean, at the end of the day, this is actually a measure that not only is effective in addressing carbon emissions and fighting climate change, but it actually is an affordability measure. Like, if you look at what the University of Regina said, it's the lower income people that benefit. 96% of people who earn less than, I think it's $70,000 a year, get significantly more money back. You take that rebate abate, you are making life unaffordable for the people who are actually the most vulnerable.
The Biden administration is halting LNG export, the expansion of LNG export. I would say, what do you make about that? And do you think that offers an opportunity for Canada to, fill in the demand that the U.S. might not meet?
Well, my understanding of what President Biden is doing is saying we're going to pause and try to integrate climate considerations into how we actually think about LNG exports going forward. And I would just say we welcome that decision. Canada's been doing that now for several years. I mean, that's why we are putting methane regulations, 75% methane regulations in the upstream. That's why we are requiring best-in-class emissions, which means liquefying using electricity, clean electricity, not natural gas. I've spoken to the administration about this in the past, and they had no way of actually integrating climate considerations into how they actually were doing LNG. We've done that from the very beginning to ensure it's compatible with our climate plan. So we welcome the Americans following us on this path.
Do you see this as an opportunity to get more clean Canadian gas out?
I think there is an opportunity. We see that, wood fiber and Cedar LNG was just approved. Wood fiber is in the process of being built. I think there's an opportunity, but it's on the basis of Canada offering the lowest carbon intensity natural gas in the world and ensuring we're linking it to the displacement of heavier hydrocarbons like coal. Thank you.